Hello, I'm Dr. Satwik Metgud. I'm a gynec laparoscopic surgeon and an infertility specialist working as a consultant in Metgud Hospital in Belgaum. Today we'll be talking about hysterectomy. It is a surgical procedure in which we plan to remove the complete uterus. So who needs a hysterectomy? There are specific indications to do this surgery. There are patients who have heavy irregular vaginal bleeding, probably due to a fibroid uterus or maybe endometriosis, maybe adenomyosis, or in cases where patients have cancer, that is malignancy of the reproductive tract, of malignancy of the uterus, ovary, endometrium, etc. Another cause where we might have to do this procedure is in case of a genital prolapse, that is a uterine prolapse in which there is a descent of the uterus outside the vagina. Not all of these problems require a surgical procedure always. There are definitely a much more medical and conservative management treatment options that are available. So surgery is recommended only if when we fail to treat it by a medical management or a conservative management. There are three types of hysterectomies that we perform. Number one is the vaginal hysterectomy, in which the entire uterus is removed from the vagina. The patients who are recruited for this procedure are the ones who have a genital prolapse or a vaginal prolapse in which the entire uterus is removed vaginally. But there are definitely limitations to do this procedure in all the patients. In case if the patient has a very large uterus or there are history of previous surgeries, it becomes difficult to do this procedure. The other method of hysterectomy is an open hysterectomy. Here, in an open hysterectomy, we take a long incision, that is around 8 to 12 centimeter incision on the lower part of the abdomen, and the entire procedure is completed through that opening of the incision. Here, since we are taking a long incision, the number of days in the hospital is more, and the recovery time for the patients also increases. The another method is the laparoscopic hysterectomy. Here we don't take a long incision. Instead, we take multiple small incision, which is 0.5 to 1 centimeter incisions at 2 to 3 ports are placed at the abdomen wall, and the entire procedure is completed through these incisions. Here, the largest port we put in a laparoscope, and the entire internal organs are visualized through the scope on a television monitor screen, and we put in small instruments that through the working ports. The entire surgery is completed through these ports. This offers a wonderful advantage, that is, the recovery time is very less, the pain and the surgical complications are relatively less compared to the open method, and number of days of stay in the hospital also is very less. The scar on the abdomen is very minimal as we take multiple small incisions, as small as 0.5 centimeter small incisions are only taken, and probably after 2 to 3 months of the surgery, those scars are not even visible. Patients can get back to their work as soon as within 2 weeks to 3 weeks time, whereas it would have taken months, 2 to 3 months in the open surgery. So there are definitely many advantages of doing a laparoscopic surgery over an abdominal surgery.